Hello, my name is Patricia Brothers, and this is my transcultural nursing presentation from a Mexican culture perspective. The Mexican culture is a combination of three influences. You have the Native American culture, Spanish culture, and the Mexican culture. Today, the Mexican culture is highly influenced by the Catholic Church. In the Mexican household, the man is considered a figure of authority and makes all of the decisions. The woman cares for the children and the household. The Mexican culture focuses greatly on family and interpersonal relationships. Mexican food and celebrations are greatly appreciated among the Mexican culture because it creates a community of kinship and a bonding experience. Cultural attributes. We all have our different perspectives on how we define health, and each culture have their different perspectives about health. The Mexican culture defines health as the physical or mental illness that may be attributed to an imbalance between the person and the environment. Influences include emotional, spiritual, and social state, as well as physical factors such as humoral imbalance expresses too much hot or too much cold. Hot and cold are intrinsic properties of various substances and conditions. Some examples of hot diseases or conditions and cold diseases and conditions are presented here. Let's talk about cold diseases. These examples consist of menstrual cramps, rhinitis, and pneumonia. Some hot diseases are known as pregnancy, hypertension, and diabetes. Another example that I have not listed that the Mexican culture may also consider as emotional imbalances is called envidia, which is also known as envy. And when the Mexican culture believes that envy can be provoked by success but can result in misfortune and illness, they believe that having envy towards another person causes illness and bad luck. So to correct these imbalances, people consume food or herbs with the opposite quality in the Mexican culture. For an example, cold conditions are treated with hot medications. When providing health care, the Mexican culture begins with folk medicine or seeking assistance from relatives or neighbors. Common herbs used are tea, chamomile, cinnamon, and mint tea. Illnesses are often treated with herbs and remedies communicated through women in the family. The beliefs to use folk medicine lead to the underutilization of modern scientific medicine. Now, in that fact, I'm not saying that the Mexican culture do not use any type of modern scientific medication. It's just used less frequently in this culture. Some of the reasons may be, financial issues, but their first result is that folk medicine. Healthcare is usually provided in their household, and admissions to healthcare facility is usually the last resort. The people of Mexican culture uses the faith of God and understanding of illnesses in the cure. Now we're going to talk about nursing care across the lifespan of childbearing women and their families. Pregnancy is viewed as natural among the Mexican culture. This means that they're not going to take medicines for nausea or headache, some of the common symptoms in pregnancy, because they consider it as a natural cause. So they're going to go through the experience naturally. The extended family and community exert a strong influence on health practices related to pregnancy and childbirth. Women who work outside of the home usually continue to do so if absolutely necessary. When going for checkups, women usually bring along their husbands, sisters, mother, or any other female relative. Female relatives tend to play a significant supportive role throughout the pregnancy. Cultural sensitive nursing care for childbearing women and their families. As healthcare providers, we must involve the family in the patient's care. We must assess health beliefs and practices. We must examine the importance of the health beliefs and folk medicine as part of the health care, and encourage disease prevention and health promotion. Cultural sensitive care for children ages 0 to 17. Children of the Mexican culture are very expressive and warm with close friends and family, and embracing is common. But when speaking with children of this culture, the tone of the healthcare provider's voice should be respectful and polite. Children should be included when healthcare providers introduce themselves. With establishment of rapport, over time, healthcare providers are permitted to be less formal. Touching a child's head is believed to cause an illness called catarrh de malaria, which causes vomiting, diarrhea, and dehydration. Nurses should know that touch by strangers is generally unappreciated and can be stressful or perceived as disrespectful. Cultural sensitive care for adults ages 18 to 64. In this section, I list some do's and don'ts for the healthcare providers. And we do shake hands and always start with the oldest person first to demonstrate respect. In the Mexican culture, we allow silence to be a part of the evaluation process. A patient's silence may indicate doubt, shyness, disapproval, politeness, or not understanding. Silence should not be interpreted as an agreement or disagreement. You want to make sure you allow personal space or distance, usually about 1.5 to 4 feet, because being close indicates offensive behavior. You don't want to call a person by his or her first name because this is indicative of being disrespectful. Do not point at a person. Do not raise your voice when communicating with people in the Mexican culture because this is considered as a sign of anger. Touch during examination because patients may feel uncomfortable, so we do not want to touch this patient. Maintain eye contact because it's perceived as a challenge or intimidation. Cultural sensitive nursing care for older adults 65 and over. In the Mexican culture, elders are held in high admiration, and old age is viewed as a positive time in the life for the elder. Care for elders is provided by the extended family. It is expected that children will care for their elderly parents. Healthcare providers should establish a relationship with the elderly and his or her family prior to care. They should be receptive to the family suggestions because each of the family members contributes to patient health outcomes. You want to make sure that if this elderly person does not speak as much Spanish, provide an interpreter. Healthcare providers should provide written educational materials in Spanish and pictures to help facilitate care. Cultural sensitive care for the communities. A key approach to reaching the Mexican families is to go through community channels, given that Mexican Americans often receive service-related information through internal sources as family, friends, and neighbors. Cultural sensitive care for communities. Provide bilingual Spanish-English healthcare providers to visit community centers, churches, and healthcare clinics to present information to Mexican men and women about different diseases. Healthcare providers should establish rapport with Mexican families and conduct home visits to provide information to improve family skills and increase knowledge about healthcare practices. Education should be provided to healthcare providers about cultural considerations for the Mexican culture because decreased knowledge about their culture can be a barrier to healthcare. In conclusion, knowledge about the Mexican American culture helps nurses establish trust, develop rapport, determine healthcare resources, and develop care that will be acceptable to individuals of this culture. Having knowledge of and respect for the healthcare beliefs of Mexican American clients and their families create a therapeutic alliance that improves healthcare outcomes through increased understanding of healthy practices and therapeutic interventions. Learning about the Mexican culture's shared beliefs, values, and behaviors helps us to understand culturally appropriate healthcare that meets the needs of Mexican Americans. I would like to thank you for your time and listening of this presentation. Thank you very much.